blog post recently by a US thought leader, and he was basically saying, people used to talk about content being king. He's now saying, that's shifted to context. So if we think back to the reference framework we talked about, you're looking for your peers to give you context to the information that you're taking in. So yes, you need to be able to trust that your network of peers is reliable, but there is an element of a safety net there in the first place, just with how the social nature of it works. It's like your friend recommending a restaurant to you. You quickly understand whether your palate aligns to theirs or not.
So I have another question on Twitter. So we'll just do the Twitter one, and then we'll get your question. So we had SM Lohner has said, is there a discussion around how to create a culture of sharing without creating a culture of sharing private health information? So I'll kick that off with one of the examples that we talked about in the UK was an organisation called Health Unlocked, and it is really important that if you're going to build a patient community, that it is credible, and it's if you're going to encourage people to share their health and personal experiences, it is important that it is a really credible, safe place for them to do that. And Health Unlocked is worth a little look at if you have a time after this session, healthunlocked.com. And what they do is partner with patient organisations, and they have all the technology to actually partner with a group to actually build a community where patients do share, and often quite in-depth patient information about their treatments and a host of other different things. So I would kick it off by saying make sure that if you are a patient, you kind of partner with a credible, kind of get involved in communities where they are credible, and there isn't any charlatans creating a dodgy community to attract. So any other?
I think that what Aaron's Neil's sort of alluding to is that as you take this step and you want to invent or work inside of a community, you can't just be a consumer of content online. You actually have to be a digester or understander of that content. You can't just look at a message board or forum and say, oh, this is an active forum, I should be part of that. You have to get to the underlining, what is this forum for, and does this agree or align with my goals? And I know here in the US, we deal with HIPAA all the time, where we have problems with putting information in certain locations and putting information in public, so it becomes an issue of storing information versus providing portals for that information. So it is something that we have to deal with on a daily basis, and there is sadly no easy solution for that.
Take another question. So our colleague with the red scarf.
Yes, I'm wondering how social media can be used for global health research advocacy, or just advocacy in general.
Okay, so the question was, just so that people listening can all hear it, how could social media be used to support advocacy activity?
I'll kick off with the first thing that social media can really do is we have to stop thinking it as a brand new set of tools or a new way of doing things. They're just new tools to do the things that we've been doing for years. So looking at the way that we connect with people, instead of if you look at what we're doing right now, we have more than just what's going on in this room. I think we were at 80-some viewers with multiple networks online watching our live stream. So taking social media to make as Aaron had talked about earlier, making a connection beyond geography. We're no longer in a community based upon proximity. We're in a community based on connections and ideas. So finding communities that you can tap into and connect them and start giving people resources to build off their own advocacy networks. So if you have tools, content, and information portals that you can pass to somebody and say, here's an instant website that you can build off of our website that can promote you locally, that will give them an option to be more prominent in their space. So building a national concept with local tactical engagement to sort of give you a global field right away.
Yeah, no, I think that pretty much covers it. It is about finding people who share common beliefs to you, and then understanding where they're at. So upskill them in social media so they can branch out further themselves. Or if they're already in that space, then get into a rich dialogue of sharing ideas, sharing knowledge. I don't know if many of you use the tweet up function on Twitter, but we use that for our industry, a regular one on a Friday, and it's an incredibly rich way of guiding conversations, sharing ideas, and inspiring people globally. So real-time conversations where information can be shared and passed, and it only takes up an hour of your week, is an example of how social media can be used to build relationships and to accelerate ideas and plans of action.
Sorry, I didn't hear you. What was that function on Twitter?
I mean, it's basically using the hashtag function to then organise a set time period where people join an online dialogue about any given topic. So you can set up a Google Word document where you submit questions for the week, and then a curator moderates that discussion in real time, and then you share the learnings back to the broader community afterwards. It's just a very powerful tool of gaining global insights.
And there's a number of very large Twitter groups with hashtag. It's hashtag IHSMS. That's the main US one. And then there's an EU group, so IHSMS. And then Spain have now got a group, Canada have now got a group. So pretty much the groups appearing all over the world with the sort of hashtag IHSMS. So it's worth having a little look if there's something in your area, or even set one up and get chatting with people in your area, in your country.
To go back to what Aaron said, something that I think there's lacking in the advocacy community is they often teach grassroots people how to do a movement on the ground. Like, this is how you organize people, this is how you set up flyers, this is how you get your message in front of the populist media, things like that. But there's not this is how you use social media to do that. So set out goals that you'd like to accomplish, and then associate that with tools. So if you want to build a community, either a Facebook page or another type of community page, if you want to get information out there, set up Twitter streams. If you want to get people motivated, set up live video streams from cell phones that feed into web pages, things like that, and teach people, as Aaron said, educate them the same way that you educate them to have a traditional grassroots movement, and give them a package, something that says, here's a list of apps and tools that you can download to accomplish the following tasks, and here's how it works, and actually sit down with them and explain it to them.
Yeah, and then there's some kind of boring techie bits, making sure you tag it all correctly, blah blah blah, so people it's as easy as possible for people to find people with shared ideas and approaches.
And we have a bit of a practical question, which is coming from my friends at Packer Forbes, which is a competitor UK agency. But we love them, they're very good. So they've asked, how did you initially search for where malaria was being talked about? Where do we go first?
So long ago.
Yeah, I mean, so we talked about in our methodology having an initial toe dip approach. Okay, so you toe dip with real people who experience the disease, and you talk to them, and you find out their experiences. That's the first thing that guides you. The second element is the cost effectiveness of it. So to set up a global monitoring program, as we did, it would not have been cost effective for every single market to do an initial audit. So Portugal, UK, that's me, and America, taking those patient insights, we then toe dipped into social media in our markets to have to get a feel for where the conversations were occurring, shared those learnings back with the markets, and then they were able to do a very quick validation to establish the parameters for themselves. So it's a stepwise approach. It's using a snapshot, and I think that's the key thing to take away from this. What we're looking at with all of this smart listening is a very structured methodology for getting a shot of a global conversation about a disease.
And what Aaron said about talking to an expert is really important, because with social media listening, if you don't listen for the right terms or ideas, you're going to miss the conversation. So having a 1-hour conversation with somebody who's experienced the disease, is researching the disease, in a culture that deals with the disease, can give you certain keywords that people talk about when they talk about that disease, and then you can take that and filter that into some of these automated aggregators and see what you pull. And if you start pulling quality data, not just quantity, you know you're on the right track, and then you build off from that. It's a starting point. So when you've got that list of ideas and words, you can build that into a much larger pool. Well, this is how we do it in the US. Into a much larger pool of information, and really start sifting through that with a monocle, or the spectacle that says, this is what I'm looking for, and teach yourself how to pull out that bad data. So having that conversation is really important. And that one person can build into a much larger group of people by using those keywords.
And with the toe dipping exercise, you have to be a bit of a geek as well, and basically just follow the links. But this is what we're talking about: people who are familiar with healthcare and social media, understanding how the networks are structured and how YouTube might link to Twitter, to Facebook, just spending a bit of time to dig into it. You have to put the hours in at that initial phase.
Surely do. Okay. Just a quick comment here. This is from Stuart Mail, who I know, and is in the UK. I'm not just picking people I know. And he has a very nice avatar of his cat as his Twitter profile picture, and he just made a comment saying that maybe in the developing world and in remote places, maybe a text strategy could be good for some of that.
Well, one of the things I think we need to stop doing is Zobni was a great service. I'll just use this as a reference. Zobni was a great service that came out that let you basically sift through your email and make connections to people in your email. And they mentioned that they're making email social again. So the idea that a couple of years ago, email was considered social, and I don't know if anyone picked up the latest Gizmodo feeds. They were talking about how Twitter basically came from the combination of AIM and the pager message, and combining those sort of built out this idea of social connecting to people in a fast manner. So what I'm getting to in a roundabout way is we have to stop thinking about social media just as platforms. Facebook is an amazing social media tool. Blogging is an amazing social media tool. Twitter is an amazing social media tool. But they're tools. They're not the idea or the concept. Social media, as Aaron talked about, is about making connections with people. And if you can do that through SMS, group texting, in an area where that makes sense, that's a great idea. If you can do it with connected emails and forums, that's a great idea. But you have to find the right tool for the right message in the right place. And you can't be beholden by this concept that Twitter has to be the tool for everything, or Facebook has to be the tool for everything. You really need to find the right tool to get your social message out there.
Yeah, well, what we talk about is being channel agnostic. So, the engaging proposition sits above the channel, and it's an idea which could then work in any channel. And yeah, you pick the right channel for the challenge at hand.
Actually, one other thing that's important for me in our market is to understand that social media is just another place in the park where people are at. So also, journalists are one of the main people who are leading the discussion with social media. So if you're already getting the information to traditional print and electronic offline media, they're also online. So it's another way to interact with them, to get them interested in a topic, and to get the discussion going with a longer tail than you have on offline media. It's not also a tool, it's also another place where you find the same people you're talking to offline.